Well, you guys made it. We are past giving birth, and now we get to talk about what is it actually like to meet your baby and what should you ask for and advocate for as far as those first couple hours after birth. Well, there is one most beautiful fact out of everything in giving birth, which is after giving birth, there is only one thing a baby really needs, which is to be with mom. What does a baby need most at the moment of birth? That's you, the mother. Right after giving birth, most babies are placed directly on your chest without being taken to a warmer, without being taken away from you, assuming everything is well. Because there are so many things that happen in this first hour. You both have a physiological need to be together at the moment of birth. Moms, for you to have your baby on your chest, to have them starting to breastfeed soon after birth, you are less likely to have a hemorrhage, and you get more of those really intense bonding hormones when you're actually with your baby, which makes a lot of sense. When your baby is placed right on your chest, there are so many benefits to them. Not only are they going to become calm and relaxed faster, but their heart rate is going to be steady, their breathing is going to be regulated, their desire and interest in nursing will be greater if you have skin-to-skin contact. You're going to regulate their body temperature. Having that skin-to-skin contact directly after birth also provides an immense amount of protection against infection, and really stimulates and supports their immune system. And it also, just like I said before, it releases a ton of those hormones that are going to get your milk to start coming in, as well as just help you feel that bonding and connection with your baby. Now, often this period gets interrupted, and so I would encourage you to ask for this time right after they're placed on your chest to be uninterrupted, because as your baby is meeting you, as they're laid on your chest, they are going to go through a very distinct set of changes, of characteristics that will help them meet and bond with you if they're not interrupted. So what is your baby going to do? You give birth to them. They're placed directly on your chest. You're holding them for the first time. What should you expect? Well, first, your baby is going to cry. It's good for your baby to cry. It helps clear their lungs and get any fluid out of their chest. Then you'll see that your baby is going to relax and cozy up to you and really just look very, very zen and peaceful and calm. And then after a little bit, they're going to open their eyes. They'll start responding to your voice, maybe start looking for you a little bit. And then they're going to begin to move a lot. And you'll see a lot of babies can actually move quite a bit. They might be tiny, but they are surprisingly strong. Some babies will even pull themselves towards your breast, moms. Other babies you'll have to move a little bit closer to your breast. But typically, once they get there, they will take a moment to rest after they are able to get to where they can smell your milk and smell that colostrum that you have been producing and that your baby will eat for the first few days until your milk comes in. Then they'll take some time to really get familiar with your breast. You're going to see them start to smack their lips. They might lick their lips a little bit and smell. This can take quite a while, and it shouldn't be rushed. A baby who's showing those signs is showing that they're getting ready to nurse. At some point, you'll see that they'll start opening their mouth really wide, not little like chomps. They're going to really drop their jaw and open their mouth really, really wide. And that's when you know that they're ready to start nursing. Most babies who are born when a mom doesn't use an epidural, will latch on really, really easily. Sometimes usually they'll even kind of self-attach. Sometimes, not all the time, when babies are born, when mom's had an epidural, babies are just a bit more sleepy, and you might see that they open their mouths, and you have to kind of guide them and direct them a little bit more. Babies, sometimes they nurse and let go, and nurse and let go, and nurse and let go. That is totally normal. There is no need to rush the process or worry if they're not getting enough when they're doing that. Eventually they'll latch and they'll stay on for a good 10 or 15 minutes, and eventually they'll release and you can both sleep. Babies will typically sleep for a little bit and then eat for a little bit. When they're really, really new, the first 24 hours, they do like to nurse quite a bit. It is best if you can delay all the weighing, all the shots, any eye ointments until after this process in most cases, unless you have like a special circumstance. If you want your baby to breastfeed well, having this time to bond and to slowly get to know each other and to slowly meet each other does affect the rest of the breastfeeding time. Babies who have this time uninterrupted now are more likely to be breastfeeding still in 6 months and in 6 weeks. So advocate for you to have yourself to have this time together. And just so you know, it's also very normal if you feel really exhausted from birth and if you're getting any stitches or anything like that. It's normal to need somebody to help prop pillows under your arms or to support baby, especially if you've had a longer birth. So don't hesitate to speak up and ask for help if you need it. And again, when it comes to breastfeeding is not the only good way to feed a baby, but it does take patience and practice. The first 48 hours, your baby is going to want to eat at a minimum every 3 hours, but more likely they're going to want to eat every 1.5 to 2 hours. During this first couple days, the more that you can just rest and relax with your baby and be skin to skin and give them time to latch and unlatch and learn the process of nursing, the better experience you'll have in the long run breastfeeding. And dads, don't hesitate to take turns holding your baby skin to skin as well. You also being skin to skin with you can help regulate temperature, can help regulate breathing and heart rates. And it is very, very helpful when you get in there and you try to help hold the baby and help mom understand breastfeeding as well. We do have a complete breastfeeding course that when you finish this course, when you finish all of this course, that will give you access to, so that you don't have to ponder on all the details now, try to remember everything, that when you get there, you'll have access to that information. All right, so congratulations on meeting your baby, and please enjoy this golden hour where you can just bond and be together and to have everyone else wait for you to have this moment before you move on to the more regular shots, eye ointments, weighing, and getting the cute little footprints. All right, if you have any questions about the golden hour and what to expect, as always, just send me a message and let me know.